name is Sam Glickstein. I'm the CEO of OspreyBio, where we create biotools to simplify complex biotherapy development in gene and cell therapy. So looking at therapies today, if you see what's in the clinic, this does not actually reflect what is killing people in the United States. This is because what's in the clinic is generally referred to as a single gene or single target therapy, which is good at curing a narrow set of single gene diseases, but not so good at treating, let alone curing, complex multi-gene diseases that cause most deaths. An example of this is Alzheimer's, where 6.7 million people are diagnosed, and of the 8 FDA-approved treatments, the best therapy only delays symptoms at a high cost, and inevitably everybody succumbs to the disease anyway. And the question is, so why are there no complex treatments out there in the clinic, and where are the multi-target therapies? And the unfortunate answer is that there simply aren't accessible multi-gene construction tools available for the broad research market. So that essentially means that most researchers are simply not working on these kinds of therapeutic candidates. So we at Osprey take that very seriously. And so we're introducing the clone card, which is the first accessible multi-gene construction tool that allows researchers to build multi-gene combos. This is a first of its kind tool on the market, where using a modular DNA construction system called Bird of Prey, researchers are able to swap genes in and out of what's called a vector backbone very simply, which results in a much faster and cheaper R&D cycle, as they're able to test multiple genes at once to see what works, what doesn't, in what different conditions. But most importantly, and I really need to emphasize this, is that this system does not require genetic engineering expertise to deploy. This is going to be available for all researchers in the gene and cell therapy research market. An example of what this can look like, using Alzheimer's again, we have a possible toolbox here of 3 different cards. These 24 genes would allow for thousands of new combinations and new possibilities, such as upregulating or downregulating genes at the same time, new effectors, modes, delivery systems, and even new promoters that would allow genes to be turned on and off at different times or different microenvironments in the neural cell, for example. This is the future of biotech. This is the only direction it can go, and this is how we can really start curing complex diseases. Looking at our competition, I'd just like to point out 3 main points, which is that, again, this does not require expertise to build, neither our cards or our system, our Bird of Prey system. All of our genes are competitively priced, and every single gene has that native Bird of Prey system built within it. We are pursuing the $28 billion United States discovery biotools market, specifically the $5 billion slice that comprises the gene and cell therapy portion. All of our potential customers are in research and development, so that includes a lot of academic and government institutions. We will be going as aggressively, however, towards the private sector, which conducts about 30% of all basic research in the country. Looking at our revenue, we see that between year 3 and 4, we start seeing a positive EBITDA as the industry continues to adopt desire for multi-target therapeutics, and as, again, single-target therapies continue hitting wall after wall in the clinic, as they simply cannot treat or cure complex diseases. We're seeking a $750,000 seed round convertible note, mainly to expand our product lines in the clone card libraries as well as other products, and execute an aggressive sales and marketing growth plan. Our management team has deep biotechnology experience. I'd like to point out specifically my CSO and co-founder, Dr. Thomas Reed, who is here with us today. He has built previously multi-target therapeutics that have gone through clinical trials. And he's actually also the inventor of the Bird of Prey and clone card systems, as well as point out my board, who have tremendous experience in biotools specifically, and we're privileged to have them on our team. Thank you. I look forward to seeing you all in the breakout room.